How to lower your pancreatic cancer risk. Hello, this evidence-based content is prepared by Sabur Khan, fellowship-trained consultant surgeon, and if you or someone you care about has been wondering about pancreatic cancer prevention, you're in the right place. I know when you hear pancreatic cancer, it can feel overwhelming. This is one of the most serious cancers we face. But here's the powerful truth. While we can't control everything, research shows that specific lifestyle changes can genuinely reduce your risk. Before we dive into prevention, let's quickly establish what we're dealing with. Pancreatic cancer arises from the pancreas, that digestive organ tucked behind your stomach that produces enzymes and insulin. Now, why does this matter to you personally? According to the 2017 Global Burden of Disease study, pancreatic cancer is one of the most lethal cancers, with most patients diagnosed after the disease has already spread. Here's where it gets interesting. The same Global Burden of Disease study analyzed deaths worldwide and found that the vast majority of pancreatic cancer deaths are linked to just 3 modifiable factors. Smoking accounts for 21%, high blood sugar for 8.9%, and high body mass index for 6.2%. Cigarette smoking increases your risk of developing pancreatic cancer significantly. In multiple large studies, smokers had at least 1.5 times the risk of non-smokers, and in one prospective study, current smokers showed a relative risk of 2.5. That's 2.5 times higher than someone who's never smoked. The population attributable fraction, that's the portion of all pancreatic cancer deaths we could prevent, ranges from 25 to 32% for smoking alone. But here's where it gets really interesting. The risk isn't permanent. Research shows that within just 2 years of quitting smoking, your risk fell by 48%. That's nearly half your excess risk gone in 2 years. The risk continues to level off over 10 to 15 years after stopping, eventually returning to the level of non-smokers. If this applies to you or someone you love, this is crucial information. The amount of cigarettes matters too. Heavy smokers face even higher risks, particularly those with certain genetic variations in carcinogen metabolizing enzymes. If you're supporting someone through quitting, understand this. Every cigarette they don't smoke is actively reducing their cancer risk. Several major studies reveal a clear link between high body mass, lack of physical activity, and pancreatic cancer risk. Let me give you the specific numbers from the Health Professionals Follow-Up Study and the Nurses' Health Study. These track thousands of people over years. A BMI of at least 30 kilograms per square meter, that's about 203 pounds for someone who's 5 feet 9, was associated with a relative risk of 1.72 compared to a BMI under 23. But here's the good news hiding in these numbers. Moderate physical activity showed an inverse relationship. When comparing the highest versus lowest categories of physical activity, the relative risk was 0.45. That's a 55% risk reduction, particularly among those with a BMI of at least 25 kilograms per square meter. Now, if you're worried because you're already carrying extra weight, here's what matters most. Overweight and obese individuals not only face higher risk, but tend to develop pancreatic cancer at younger ages and have shorter survival once diagnosed. This isn't about blame, it's about actionable information. What you do starting today can change your trajectory. Studies evaluating diet and pancreatic cancer show us some fascinating patterns. A Western dietary pattern, high intake of saturated fat and meat, particularly smoked or processed meats, has been linked to increased pancreatic cancer risk in many studies. We're not talking about the occasional burger here, we're talking about consistent dietary patterns. On the flip side, research from the National Institutes of Health AARP cohort found something compelling. People who met the most dietary guidelines, according to the 2005 Dietary Guidelines for Americans, higher intake of fruits, vegetables, whole grains, healthy oils from fish and nuts, and lower intake of saturated fat, sodium, and added sugar, had a significantly reduced risk with hazard ratio 0.85. That translates to about a 15% risk reduction. Now, you might be wondering about specific nutrients. Lower serum levels of lycopene, a carotenoid found in tomatoes and other red fruits, and selenium have been found in subjects who later developed pancreatic cancer. Think Mediterranean. Grilled fish with olive oil, plenty of vegetables, tomato-based dishes, nuts and seeds. Here's something that might surprise you. Numerous studies describe an association between diabetes mellitus and pancreatic cancer. But here's where it gets complex. It's not entirely clear whether diabetes causes pancreatic cancer or whether early pancreatic cancer causes diabetes. What we do know from research, in one prospective cohort study, people with elevated post-load plasma glucose levels showed relative risks ranging from 1.65 to 2.15, depending on their glucose levels. The mechanism likely involves hyperinsulinemia, high insulin levels, rather than just high blood sugar. States of insulin resistance, obesity, and type 2 diabetes may increase risk through reduced levels of adiponectin, a hormone with insulin sensitizing and anti-inflammatory properties. If you're supporting someone who's just been diagnosed with diabetes, especially if they're older and previously a healthy weight with unexplained weight loss, this warrants medical attention. While screening the general population isn't recommended, high-risk individuals should discuss their situation with their healthcare provider. If you smoke, your single most important action is smoking cessation. Within 2 years, you cut your excess risk by half. Talk to your doctor about nicotine replacement therapy prescription medications like varenicline or bupropion or counseling programs. The combination approach works best. You don't have to do this alone. Regarding physical activity, we're talking about 30 minutes of moderate activity most days. That's brisk walking, fast enough that you can talk but couldn't sing. This showed a 55% risk reduction in the studies. Start where you are. Even 10 minutes 3 times a day counts. If you're supporting someone making this change, walk with them. Dietary changes. Aim for a Mediterranean-style eating pattern. Specifically, 2 to 3 servings of vegetables daily. That's about 1.5 cups. Choose fish over red or processed meat at least twice weekly. Use olive oil instead of butter. Snack on nuts rather than processed foods. A small handful, about 1 ounce. Limit processed and smoked meats significantly. If you're overweight, even modest weight loss helps. Losing 5 to 10% of your body weight, that's 10 to 20 pounds for someone weighing 200 pounds, can improve metabolic health and reduce cancer risk factors. Combine the dietary changes above with the activity recommendations. Diabetes management. If you have type 2 diabetes or prediabetes, discuss optimal blood sugar control. Ask about, what's my hemoglobin A1C and what should it be? Do I need medication adjustments? Should I see a diabetes educator or nutritionist? If you're a current or former smoker over age 50, ask about your individual risk assessment. Mention any family history of pancreatic cancer. This changes the conversation. Sample questions for your doctor. Given my smoking history and weight, what's my pancreatic cancer risk? What specific lifestyle changes would you recommend for me? Do I qualify for any screening programs based on my risk factors? While prevention is our focus, know the warning signs. Seek evaluation promptly if you experience unexplained weight loss, more than 5% of body weight without trying. New onset diabetes after age 50, especially with family history. Persistent upper abdominal or mid-back pain. Yellowing of skin or eyes. Changes in stool color, pale or clay-colored. These symptoms warrant evaluation even if they're likely something else. Smoking cessation. Risk reduction begins immediately. Within 2 years, you see a 48% reduction in excess risk. Full risk normalization takes 10 to 15 years. Weight loss and increased activity. Metabolic improvements begin within weeks. Meaningful weight loss typically takes 3 to 6 months with sustained effort. Think 1 to 2 pounds weekly as a healthy pace. Dietary changes. You'll likely feel better within weeks with improved energy and digestion, but cancer risk reduction is a long-term benefit measured over years of sustained healthy eating. Let me quickly recap. Nearly 1/3 of pancreatic cancer deaths are linked to smoking, and significant portions to obesity and diet. All factors you can modify starting today. Your next step: choose one action from this video to implement this week, whether it's scheduling a smoking cessation appointment, taking a 30-minute walk, or adding an extra vegetable serving to your meals. I've outlined several reputable resources here, which you may find valuable for further information on this topic. These include Global Burden of Disease Study 2017, Comprehensive Worldwide Analysis of Pancreatic Cancer Risk Factors, the Health Professionals Follow-Up Study and Nurses Health Study, Long-Term Research on Lifestyle Factors and Cancer Risk, National Institutes of Health, AARP Diet and Health Cohort, Large-Scale Dietary Pattern Research, American Cancer Society, Pancreatic Cancer Prevention Guidelines, and Smoking Cessation Resources. National Comprehensive Cancer Network, NCCN, Clinical Practice Guidelines on Pancreatic Cancer. All links are available in the description below. Thank you for watching.